Baclofen is a medication used to relieve muscle spasms caused by specific conditions, like multiple sclerosis or spinal cord injury. It helps to relax the muscles, providing relief for those who experience muscle spasms. The recommended dosage of Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral solution central muscle relaxants is typically taken 3 times a day, and it is important to take it at the same times each day. It can be taken with or without food, but it is important to follow the instructions given by your healthcare provider. Before taking Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral solution central muscle relaxants, be sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually 3 times a day. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device. If you are taking the granules form, gently shake the packet before use and then empty the entire contents into your mouth and swallow. You may also mix the contents with a tablespoonful of soft food or liquid and take it within 2 hours. The dosage is based on your medical condition and response to treatment, so do not increase your dose or take it more often than prescribed. Use this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If you experience withdrawal symptoms, such as hallucinations and seizures, contact your doctor or pharmacist right away. Be sure to inform your doctor if your condition does not improve or if it gets worse. Side effects of Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral solution central muscle relaxants may include drowsiness, dizziness, weakness, tiredness, headache, trouble sleeping, nausea, increased urination, or constipation. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as changes in mental/mood, like confusion, depression, or hallucinations. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms like rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral solution, talk to your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist about your medical history, especially if you have kidney disease, mental/mood disorders, or brain disorders. This medication may cause dizziness or drowsiness. Avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Avoid alcohol and marijuana while taking this medication. Talk to your doctor if you use marijuana. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially drowsiness and mental/mood changes. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. If you use this drug during pregnancy, your baby may rarely develop withdrawal symptoms. If your newborn shows any of these symptoms, contact the doctor immediately. This drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of how Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral solution can interact with other medications. This can affect how well your medications work and may increase the risk of serious side effects. Keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication, it's important to get your doctor's approval. Let your doctor or pharmacist know if you are taking any other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, other muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using these products safely. If someone has taken too much Ozobax Ds and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include vomiting, extreme drowsiness, slow or shallow breathing, and seizures. This medication is specifically prescribed for your current condition, so it should not be shared with others. It is important not to use this medication for any other condition unless directed by your doctor, as a different medication may be needed in that case. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Ozobax Ds 10 mg per 5 ml, 2 mg per milliliter, oral Solution Central Muscle Relaxants, there are a few things to keep in mind. If you have the tablet or granules form, make sure to store them at room temperature, away from light and moisture, and definitely not in the bathroom. It's important to keep all medications out of reach of children and pets. If you have the liquid form, it's important to note that different brands may have different storage needs. Be sure to check the product package for specific instructions on how to store your particular brand, or ask your pharmacist for guidance. When it comes to disposing of this medication, it's important to do so properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard this product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.